The Cleveland Clinic brought together national leaders in healthcare, research, and advocacy at its inaugural Women's Health Forum last week. It was all to honor the one-year anniversary of the Women's Comprehensive Health and Research Center. The center's chief visionary and strategic advisor is none other than Maria Shriver. 3 News Health anchor Monica Robbins had a one-on-one conversation with her, and they tackled some difficult topics regarding women's health.
I'm glad you brought up caregivers. Women typically are the caregivers.
They're 2/3.
And we rarely are, we're too busy to take care of ourselves.
Correct.
That impacts our health.
Right.
It adds
well,
to
it impacts your
stress.
financial health too, because you so often have to drop out of a job in order to care for an aging mother or father, right? And so we need a national policy that addresses caregivers in this country today. Most of the caregivers are unpaid in this country, and those who are caregiving are often doing it at very substandard wages. So who is a caregiver? What do they look like? What should they be paid? How should they be operating? We haven't had that conversation as a nation. I don't hear people running for president talking much about those issues, talking about funding women's health and research, talking about making sure the drugs that are given to women have been tested on women. So while that's maddening, it's also an opportunity for someone to step in this space and have this conversation.
All of those issues affecting women's health in general, what's your advice to women who, you know, like you said, they're not necessarily paying attention, not because they want to, but because they're so busy.
So busy, yeah. I think it's, you know, the fact is, you know, we all have to decide how busy is busy, right? And I think that that's a conversation you have to have with yourself at some point. And do I like the way I'm living? Do I feel good about the way I'm living? And for the vast majority of people, have like, they're raising kids, they're taking care of parents, some people working 1 or 2 jobs just to get by, right? So they're like, I have to be this busy. But I would then argue, well, if you're not taking care of your health, your busy's gonna go away. This whole house that you're so busy trying to keep afloat is gonna fall down. So prioritizing whatever that means to you, time for you to meditate, time for you to take a walk, time for you to get on an elliptical, whatever it is, you have to decide and then explain it to those who care to you. You have to have a job that allows you to go off for an hour at lunch and go to the gym instead of sitting in the cafeteria. Whatever it is that works for you, you have to think about what would work for me, and then try your best to implement it and get a partner to help you, you know, implement it if your work doesn't allow for it. Because if there are more than one person advocating for it, it's often hard to say no.
That work-life balance, that reducing stress is actually...
Well, I think work-life balance is a challenge. I remember when I had little kids and people would say, just get balanced. I'm like, you know, you don't think I'm trying to be balanced? You know, I think it's hard. But I think having a conversation with yourself, what would make me feel better day to day? Is it going to bed earlier? Is it getting up 15 minutes earlier and having that quiet time to myself? Is it being able to walk somewhere before dinner or after dinner? What is it that would make you feel like, okay, I can do this. I can manage this. And that changes by the age, right? Changes by if you have 1 kid, 2 kids, 3, if you have a partner that has a disability, whatever it is. It's an individual question and an individual answer, and then look for people who will support you and hold you accountable to that answer.
You wrote a book on healing. What's your advice to help women make themselves and their health the priority?
I think it's an emotional thing, actually, to honor yourself. If you see yourself as important enough, if you see your own healing as important, which I hope one would, then to make choices that help you achieve the healing that you want. I think we have evidence of a lot of unhealed people spewing out in the public square, and people who prioritize their healing lead differently, talk differently, walk through the world differently. And I think our country would benefit from more people prioritizing their own emotional healing. That's really hard work. It's not like soft and gentle. It's tough grind to heal yourself, prioritize yourself, honor your voice, and honor your health. I look at that as probably the toughest work I've ever done. And I've worked hard my whole life. But prioritizing my healing and making it something that mattered so that I could do the other things that mattered was the best decision I ever made in my life.
The decisions you're making are life-saving.
Well, I hope they are for me, but really for me, this center, for example, I hope it to be life-saving for others. All of those appointments that you talked about that have come through here, their lives changed because this got up. And so I'm really proud of the work that got this to go up, because things like this don't just happen overnight. There's a lot of grinding and pushing and persevering that goes into making this happen. And then people then look at it and go, oh, it's successful. Now we want it, right? But I'm really happy that those lives have either been saved, helped, that people have felt seen. Those stories are what make me feel like, okay, my work matters because those people's lives are different. Even if I never meet them or they ever meet me or ever again, I know that they're better off today than they were a year ago.
Thank you so much.
Thank you. Thanks so much.
Man, I love what she said. Make yourself a priority and start taking care of you. Wow, good information.